I'm Dylan Kennedy, and today I'm going to be telling you about applied behavioral analysis, which I'll be referring to as ABA. Now, to kick things off, my son is on the autism spectrum, and he is a prime example of unlocked potential through ABA therapy. He has gone from grunting and pointing, hardly being able to communicate as a 3-year-old, to now excelling ahead of his kindergarten peers in grammar, reading, and math. Sure, it's just kindergarten, but the difference is night and day, and his progress directly stems from the outstanding ABA services that he has taken part of. So first today, I'll tell you how the symptoms of autism spectrum disorder may differ between people. Second, we'll discuss what ABA is specifically. And third, we'll discuss how ABA can be most effective if started from an early age. Now, I may be biased, but my son is probably the smartest person I know. His mind is focused on very, very particular things the majority of the time. Some things inquisitive, some repetitive. For example, he's always talking about dinosaurs and fossils. He knows all their names, their shapes, but he also has a bad habit of chewing his shirt collar, which is a repetitive behavior. Being on the autism spectrum simply shifts a person's focus towards something. Depending on the severity of the person's condition, physical sensitivities and tolerances can be high, such as light and texture for sensitivities, or pain and sound for tolerances. The Journal of Pediatrics gives a good example for symptoms of autism spectrum disorder. One child with ASD may have very well developed verbal skills, no intellectual impairment, and relatively mild forms of repetitive behavior, whereas another might be nonverbal, with severe intellectual disabilities and persistent stereotyped behavior patterns. So we've discussed how being on the autism spectrum shifts a person's focus. Next, we'll discuss more specifically what ABA is. ABA is a continual study of a person's behavior to align and improve their social and problem-solving skills. It's a study of a person's areas in need of improvement. By studying a person's response to preferred and non-preferred activities, a therapist can more accurately see how to help in a discrete manner. This discrete manner can be compared to assisted practical application, to include reinforcing rewards for following directions. The Journal of Pediatrics states that children who show behavior problems and skill deficits in multiple areas are candidates for immersive ABA treatments that might be conducted 25 or more hours weekly. 25 or more hours. So why would studying a person's behavior help them if it's just continual, ongoing analysis? Well, therapy changes and adapts to that person's needs. So the earlier it's adopted in their development cycle, the better. An initial diagnosis on the autism spectrum before the age of 3 is the best first step, which opens doors to obtain seats for this therapy. Some patterns of behavior to watch for, if you're looking for a diagnosis, include walking on tiptoes, flapping hands, or the sensitivities and tolerances that I mentioned earlier. Early childhood is the prime point in development to implement good behavior patterns. It's never too late to start. It'll just need to be a little more difficult if it's later on in the process. In conclusion, if ABA therapy is continual, it is always going to be changing to the benefit of the person receiving it. ABA is not a means of curing a disease of some sort. It's a method of helping people on the autism spectrum to show their true colors and make the impact on the world that they were always meant to. I hope you learned something today, and I'll see you next time. Thank you for watching.